the earlier stages, as marketplaces, we all typically face the kind of chicken and the egg, right? So what was that like with Incredible Health, and how did you kind of overcome that in the early stages?
Yeah, there's a few ways we overcome it. So in our case, like the chicken and egg problem is very classic. We had to get both in order for the marketplace to work. There was no shortcuts there, but there were certain decisions we made that helped getting both sides of the platform more feasible. For example, we really restrained it geographically. When we started work, it was only the San Francisco Bay Area when we started, right? In fact, our first 2 years of the company, we were only in California, primarily the Bay Area and LA. And it was in those 2 years that we ensured that our operations were in decent shape, that our product was in decent shape, that we had good unit economics, that we could get talent through our funnels, et cetera, and drive success for both sides of the marketplace. And we didn't really focus on growth at all. It was just on building in a very constrained geography. Now, of course, we needed to add nurses and employers, but there was a lot of close interaction with those users, a ton of feedback going back and forth. I mean, I would say like the Bay Area hospitals and health systems played a huge role in our product roadmap in the first couple of years. That's how that was a key way we solved that in the early days. Obviously, if you ask me today how we solve it, it's a completely different answer. But like you asked me about the early days.